I'm Dr. Stan Yates with Stork Advisor, and I would like to thank you for joining me today. As an obstetrician and gynecologist, I have encountered countless mothers who've experienced ups and downs of breastfeeding. Some symptoms may be embarrassing for the mom to report after the baby is born, particularly sore nipples. This issue is far more prevalent than you might imagine. As the onset of breastfeeding, sore nipples can be challenging. The pain is experienced by nearly 90% of new mothers. The silver lining here is that for the majority of women, the solutions are simple and quick. In today's discussion, I will share the typical triggers of sore nipples. I'll mention swift relief methods that have proven beneficial for many. Finally, I'll outline strategies to prevent future discomfort. Taking prompt action can vastly improve your breastfeeding journey. So let's tackle this issue together. By the end of our review, you'll have a practical set of solutions to make your breastfeeding journey smoother and more fulfilling. Before anything else, let's identify what could be causing your nipples to be sore. Understanding the root cause of the problem is halfway to the solution. When you mention Latch to new parents, they usually ask, well, how difficult could it be? In reality, mastering it is a technique almost like a talent. An appropriate latch is when the baby's mouth encompasses not only the nipple, but a significant part of the areola, the colored area around the nipple as well. Once you've got the hang of it, you'll notice a distinct difference in breastfeeding. However, an incorrect latch can result in significant discomfort for moms. If your child is primarily sucking on the nipple alone, it can lead to soreness. If you're experiencing a pinching or burning sensation during feeds, or if your nipples appear misshapen or flattened afterwards, it may be time to reconsider your latch technique. Engorgement is another common breastfeeding issue. Imagine waking up to the feeling of 2 bowling balls attached to your chest. That's a sensation of engorgement, a case of the breast becoming so stretched out with large amounts of milk, it can make them feel firm, swollen, and very uncomfortable. The tricky part, engorgement can hinder a proper latch. Then the nipple discomfort is worse. It may seem like a recurring cycle, but remember this usually subsides as your body adjusts to your baby's feeding patterns. A fungal infection or rash is a common condition that is often overlooked. Some mothers experience a persistent burning sensation on the breast that doesn't fade after nursing. A scaly pink rash on the skin in the breast area is a common sign. The rash may be a result of a fungal skin infection. Burning and/or itching are typical symptoms. And thrush is a yeast infection in the mouth of the baby. If the baby exhibits white patches inside their mouth, it's further confirmation. For persistent pain or any unusual symptom in you or your baby, it's essential to seek consultation from a healthcare professional. Having covered the causes, let's move on to how to get some relief. Proven techniques which have been instrumental in providing comfort to many mothers. First and foremost, a focus on the latch is good. Align yourself comfortably with the adequate back support to make a substantial difference. It's a good practice to bring the baby to the breast rather than the other way around. A helpful trick is the flip-flop technique. Gently stroke the baby's upper lip with your nipple, wait for them to open wide, then quickly usher them onto the breast. If difficulties persist, I strongly recommend seeking assistance from a lactation consultant. For many, the experience of a lactation consultant has been a lifesaver. A routine of moist heat followed by cold compresses have brought relief for numerous mothers. Applying a warm, moist compress to the breast for a few minutes before feeding facilitates milk flow and eases latching. After breastfeeding, switch to a cold compress. The cooling sensation can be tremendously soothing on a sore nipple. Use a soft cloth to wrap an ice in a Ziploc bag or use a moldable cold pack. Just gently place the cold pack or ice pack for about 10 to 15 minutes. Nipple creams and ointments are extremely beneficial during the initial weeks of breastfeeding. Lanolin-based creams are highly recommended since they form a moisture barrier that aids in protection and healing of sore nipples. If you prefer a natural alternative, coconut oil performs remarkably well. Simply apply a thin layer following each nursing session and let it naturally dry. No need to wash it off before the next feeding. It's harmless for your baby. Prevention, as they say, is better than the cure. Here are some strategies to prevent the causes of sore nipples. First, practice good hygiene. This idea may seem obvious, but it's easy to be sleep deprived and not think clearly as a new mom. Good hygiene is easy to overlook. It's a good practice to wash your hands before and after every breastfeeding session. This routine significantly reduces the risk of skin or breast infections. Breast pump cleanliness is also crucial. All parts of the pump need to be thoroughly washed after every use. If you use breast pads, change them regularly. Do your best to dry and clean the breast skin surfaces. Alternating between different breastfeeding positions can have a positive impact to prevent breast soreness. It helps to distribute the pressure from nursing on various parts of your nipples. Try rotating breastfeeding positions between the cradle hold, football hold, and side-lying positions. It's okay to experiment and discover what works best for you and your baby. Each mother-child pair is unique. We've covered a significant amount of information today. Remember, sore nipples are common in most breastfeeding journeys, but the symptoms are not insurmountable. From improving your latch technique to application of soothing compresses, there are many ways to get relief. In the majority of cases, nipple discomfort is temporary. Your body is acclimating to this new role of nursing your baby. It usually gets easier. However, if pain isn't improving, or if you're having other concerns, reach out to your women's health care provider or a lactation consultant. Despite the challenges of breastfeeding, it's a deeply rewarding experience, a unique bond that you forge with your little one. With these tools at your disposal, I hope you'll be able to enjoy it to the fullest. You are investing in your child's future with this act of love. This is Dr. Stan Yates with Stork Advisor. Thank you for joining me today. See you next time.